submitted by voters. Any opinion expressed tonight are those of the candidates and not of the League of Women Voters, Sarasota County. This forum will be conducted without rebuttal. We ask all candidates to speak only for themselves and not to provide insight into their opponents. We look to candidates to help us understand their policy positions, problem-solving skills, and values so that we can make better choices as informed voters. And now, to begin, the order for the first question will be Sharon DePeters, Bud, Lori, Tram, Benolia, Britt, Vicky, Sarah. And the first question. Please introduce yourself and tell us about your education and experience that would help you if elected to the board.
Okay, my name is Sharon Wetzler D. Peters, and for the past 4 years, I've sat on the board as a healthcare provider with 21 years of experience in the Air Force and 14 years as professor of nursing at State College of Florida. Serving on the board as a nurse practitioner allows me to partner with other leaders to promote change and advance health. The call for nurses to serve on the board is important because it provides a unique perspective in the healthcare arena. I serve our community with pride and expertise, offering valuable viewpoints that promote dedicated leadership, focused on exceptional, well-educated staff, patient-centered quality of care, safe, efficient working environment, and state-of-the-art technology. I speak their language, both medical and nursing, and I believe a nurse on the board is a voice to be heard.
Thank you. My wife and I have been full-time residents of Venice since 2006. I want your vote because I want to keep doing something that I've enjoyed my entire life. I have a BA in business administration and a master's in health and hospital administration. I last served 25 years as the president and CEO of a community not-for-profit 136-bed acute care hospital in Ohio. During that time, I've overseen the construction of a new patient tower, surgical procedures additions, an emergency room, with a heliport. I've created physician management companies, physician offices, and a durable medical equipment company as well. And during the course of my career, I have held a number of hospital administrative positions and served on a large number of hospital association, and community boards. I'd love to share my experience in a helpful way to continue the excellent work of Sarasota Memorial Hospital System.
Lori?
Hi, everybody. The Sarasota Memorial Hospital's vision is to serve our community with the best healthcare system in America by being the best place to be a patient, the best place to work, and the best place to practice medicine. The SMH board and the hospital administration is accomplishing this vision. SMH is one of only 57 hospitals in the nation to earn high performer ratings in all 9 procedures and conditions evaluated in the U.S. News Best Hospital Study. SMH has received magnet recognition from ANCC, and SMH has received 6 consecutive A grades for patient safety. So with this tremendous success, why make a change? I'm running for hospital board to be part of Chair Meister's team to continue to strive for excellence. As a co-founder and CEO of the largest publisher of National Science Foundation funded programs, I believe I could add a great deal to the board.
Tram?
My name is Tram Hudson. I have been in Sarasota since 1986 and have had the privilege of raising my family. My wife and I have been here. We've raised our 3 children. We're now adults. We've got 4 grandkids. Now we've had a great time in Sarasota. I'm a retired banker. I'm also a retired lieutenant colonel from the Army Reserves. Have spent a lot of time in different organizations in Sarasota. providing leadership. I'm a past chairman of the Sarasota County Chamber of Commerce. I was on the board of Manatee Community College before it became State College of Florida. I'm a past chairman of the Republican Party in Sarasota County, along with a number of other organizations. I am running for re-election for my second term with Sarasota Memorial, and I appreciate all the nice kudos given to Sarasota Memorial. But we've been very focused as a board in operating under a strategic plan that we've been focused on doing a number of things. And I would like to see the continuation, successful completion of the hospital in Venice that will come online in 2021. Our initiative with the Cancer Institute is important. And anyway, I look forward to talking with all of you.
Finolia.
My name is Finolia Irajosa. I am a medical doctor. I was born in Haiti. I lived in New York for many, many years. I have a bachelor's in psychology and pre-med, and I went to medical school in Mexico, came back to the US, and I worked in Brooklyn, where I had the opportunity to work with a diverse population of people from all over the world. I am now the CEO of Safe and Guard Home Health Care. It's a private duty home health agency. We are going Medicare because we noticed there's a large population here that really use Medicare. I moved here because I was looking for a place to come with my children and my husband, and we love it here. We live in Venice. I noticed there is a need for more diversity in the medical board, and that is why I'm running. I've only been here a year, so I had to do a lot of research, and based on what I've experienced, and that's why I feel like I would bring a lot of different diversity. My husband is from Africa, and I've traveled all over the world, and now I'm doing an MBA as well at Everglades University.
Thank you. Britt.
My name is Britt Reiner, and I'm running for re-election to the hospital board. I was born and raised in Sarasota and am blessed with a family legacy of service. My mother taught in Sarasota Public Schools for 34 years, and my father served in the Army Special Forces. After Dad returned from Vietnam, the VA designated him 100% disabled, so my family knows the need for quality health care. I went to Duke on a full scholarship, and I earned a master's at Stanford. I've worked at 3 publicly traded companies and multiple nonprofits across the US. But ultimately, my heart led me home to Sarasota, where my husband and I are raising our 3 kids, all born at SMH. I have my own business, and I serve as a community volunteer and leader. I'm running for re-election to the hospital board because 1, I champion the relentless focus on fighting COVID. 2, I'm an advocate for SMH expansion so we can meet community health needs such as building the Venice Hospital, the Cancer Center, and the Behavioral Health Pavilion. And 3, I'm focused on maintaining our best-in-class patient care, which SMH is known for. Thank you.
Vicki.
Hi, everybody. I'm Vicki Nice-Swander, and thank you, League of Women Voters, for having us present ourselves today. And I'd like to share who I am and what I'd like to be doing. My public health career, along with my volunteer work here, provides a unique and needed voice and lens for our Sarasota Memorial Hospital. I believe there should be a balance of skills on the hospital board, particularly in these critical times where our hospital has a key role. A public health perspective is presently missing. I will bring over 26 years of public health experience to the table, where my work included being the initial HIV/STD program supervisor and coordinator, and including partner notification I worked in Washtenaw County, Michigan at that time, and did that for 14 years. I was the regional chair of the HIV planning group and served on various committees at the state and chaired a number of them as well. The early days of HIV were filled with community fears, lack of knowledge, people succumbing to a very sad death, and many at a very young age. I have a BS in biology, a Master's of Arts in Teaching, Secondary Sciences, and an MPH in Health Behavior, Health Education, and Administration. I have an environmental health
Thank you.
experience.
Thank you. Sarah?
Okay, thank you.
Sarah, you're muted.
Sorry, guys. Hi, I'm Sarah Lodge, and I'm running for re-election of the Sarasota Hospital Board. I'm a Florida native and a proud mom of 3 children and a passionate volunteer. I'm running for the hospital board to serve our community. I was born and raised in Florida and moved to Sarasota in 2006 after visiting with my husband and falling in love with this beautiful community. We feel blessed to call Sarasota home and want to ensure that all of our neighbors flourish and enjoy their life here. I am a certified financial planner, and my husband owns a small business. All 3 of our kids were born at Sarasota Memorial Hospital and now attend local schools. So it's easy to say we are deeply rooted in Sarasota and will not be leaving. I've volunteered for many organizations in this town, and recently, in the past 7 years, I've focused on 3. I've been president of the Junior League of Sarasota, president of the Rotary Foundation of Sarasota, and I was a founding board member of Impact 100 SRQ. We believe that to be a part of a community, you must be involved and volunteer, which is why I'm giving my time and my effort into making Sarasota Memorial the best hospital we can be.
Thank you, Sarah.
Thank you.
Our next question is, if elected, what would your top priority of the board during your term? What would be your top priority of the board during your term? First question is directed to Bud, followed by Sharon, Tram, Lori, Britt, Finolia, Sarah, and then Vicki.
Thank you. In order to respond to that, I believe that one of the primary things would have to make sure that I understood the healthcare inventory of all of Sarasota's outreach so that we can make sure that we are meeting the community needs at every level. One of the things that was introduced only in the paper to me the other day was the behavioral health building, which will be a brand new entry to serve a lot of people in this area. That, coupled with all the other outreach programs that we know have to meet the customer's needs in the next 20, 30, 50 years. Thank you.
Sharon?
Yes, there are several issues that I have as priority. The first one is the COVID and the flu. And coupled with the hurricanes that are now coming, we are working with the hospital, with authorities, with staff, with medicine, with infectious disease, and we're doing a tremendous amount of preparation. That is our top priority. We also have things going. The hospital's being built, the Cancer Institute is being built. We need to get people working, we need to recruit people in, and we need to get things up and running. These are priority issues that we've been working on and preparing for quite a while, and those are my first things to do when I get started.
Tram?
Thank you. As I mentioned earlier, I've been on the board for 5 years, and I think one of the key things the board has done successfully is adopt a strategic plan that not just plans for the next year or 2, but looks out 10 years. And the 3 major priorities for the board right now, which I support, is the completion of the hospital in Venice. That's a $350 million undertaking. We need to bring that on time and under budget. The Cancer Center, we are going through a new wing that we're building onto the main hospital. Again, a huge financial investment to address the community need of cancer treatment. And the third that a lot of people don't know about is we're facing a doctor shortage in Sarasota County. We have a graduate medical education program where we have residents in internal medicine, emergency, and palliative care, and I hope to see that continue to be successful. Thank you.
Thank you, Tram. Lori.
Aye. Well, first of all, Tram, I absolutely agree with you that accomplishing the strategic objection of SMH is paramount. All of the objectives in the strategic direction, I absolutely believe in. I would add, I guess, 2 specific priorities. One, I'm a big believer in behavioral health. Sharon, you mentioned the incredible nurses. Right now, our nurses and our doctors are under so much pressure because of COVID. We need to support our providers. And I think we need to, in addition to the wonderful facility we're building, the new behavioral center, really also look at how we're incorporating behavioral health into every aspect of the hospital. Finally, I think that a best offense is a great defense. Sharon, you also mentioned being prepared, making sure that we really anticipate what can happen with rising sea levels, with hurricanes, with red tide, making sure the hospital has the inventories, people, supplies that we need.
Thank you, Brett. Lori?
Well, that was me.
I'm sorry. Thank you.
I could go again.
No, no, it's okay. Brett?
I look forward to agreeing with some of my fellow current board members as they've shared about the Venice Hospital that's coming online, as well as the Cancer Center. Many people don't know this, but 40% of Sarasotans who are diagnosed with cancer care leave this county to receive their cancer care. That ought not to be. That puts a huge pressure on the person receiving treatment as well as their family members. But now that we're having the Radiation Oncology Center, as well as the Oncology Tower, as well as once Venice Hospital is built, a cancer wing there, we are making it so that people don't have to leave home for cancer care, but now people will be coming here for cancer care. I also want to talk about behavioral health. Mental health is a national crisis, and Sarasota is not immune to it. We are going to be completely overhauling how we serve the mental health needs of Sarasota County residents. This means that it will no longer just be inpatient, but also outpatient. There will be a continuum of services, and we'll be applying many of the learnings that we've used with the Cancer Center and Venice Hospital, so these patients receive the dignity and respect they deserve as they heal.
Thank you. Finolia? You are still muted, Finolia.
I would love to bring attention into anti-aging, Alzheimer's, and mental health for the seniors. Also, issues relating to when they're at home and how they get care and help with things that they need, because I see sometimes when they're at home right now, especially with COVID, there are a lot of people who are going through things and they need somebody to communicate with them. So program with the hospital to help the people at home. And also children, believe it or not, have been affected by COVID. So program that would help dealing with mental issues or mental aspect of that. And also for workers, because workers have a hard time dealing with all this COVID issues. Some people are afraid to go to work. And also to continue work with the hospital that is being built. And hurricane preparation, more training and understanding of what's happening. And also the Red Sea, the red tide issues.
Thank you, Finolia. Sarah?
Hi. We are blessed to live in a town where we have such a wonderful healthcare system. But I think most people in our community don't realize how many facets it is and how far it reaches. So I would agree with my fellow board members sitting here today. We are going through incredible growth, and that's with our strategic plan. So I think my first priority is to stay on course with our strategic plan, because it looks at all aspects of what we need in our hospital and healthcare system, whether it's the Comprehensive Cancer Institute, the Venice Hospital, Bayside Behavioral Health, and then looking at COVID, hurricanes. All of these things are important, but they are in our strategic plan, and we have a focus to maintain that and to move forward and grow. Lastly, I would say the innovation and forward thinking of technology and how that is incorporated into our hospital and how we grow with, whether it's telehealth or, technology for surgeries. All of that is going to be very important in the next 5-10 years.
Thank you, Sarah. Vicki?
Hi. Yes, I ditto everything everybody has said. And being the last one here, that's a big ditto because I'm really impressed with everything that Sarasota Memorial Hospital has been doing, and its strategic plan hits the mark. However, we are in a bit of a new challenge with COVID, and we're all trying to rise to that. And I want to make sure that there's enough community networking going on. The Memorial Hospital can't do it all by themselves, nor should they. And I've been in communication with some online groups of people who are at home dealing with COVID by themselves. I've been talking to the director of the health department, and I've been feeling those issues out with the needs that are at home for these people. So I definitely want to make sure that those issues are addressed.
Thank you, Vicki. The next question is, if elected, what measures would you take to address the high turnover rate of healthcare professionals at Sarasota Memorial Hospital? And the first question is directed to Lori, followed by Tram, Finolia, Britt, Vicki, Sarah, and Bud. Okay, Lori, you're muted.
Okay, hi. Turnover is a huge issue. In our corporation that we created, we saw that same issue with teachers around the country. I think that one of the best ways to deal with turnover is professional development for the team, continued education of all sorts. Again, I think we really need to support our providers. I think also making the objectives of the hospital crystal clear and really creating an environment of collaboration so each person can have their voices heard and take ownership in the success of the hospital as well as their own success.
Thank you. Tram?
Kitty, I would take exception with your premise and your question. And let me explain that. We have over 7,000 employees in the Sarasota Memorial Healthcare System. Of those 7,000 employees, our turnover is really very, very small when you consider that the primary turnover is in those employees who have been employed for less than a year. And frankly, it's in the hospitality area of the hospital, the janitorial service, the food and beverage. We compete in Sarasota County for the same labor pool. And frankly, before COVID-19, we were competing with the Ritz-Carlton, with the Hyatt, a large number. And so the turnover among that class of employee is high. It's, I think, around 25%. Those that have longevity of over a year, it's very, very small. And the board looks at this every month. And if the other candidates attend the meeting, they'll see that that is reported on monthly.
Thank you, Tram. Finolia?
Yes, I think having the hospital letting all the employees know their the clear vision and mission of the hospital, allowing them to be a part of the team, treating them with care, compassion, bonuses, and special like vacation, extra things to, find out what they need. For example, mothers who have children sometimes might need maybe a program in the hospital where they could leave their kids or some program nearby. So there are a lot of things that makes employees a lot more happier when they work in a particular area. So it's also taking time to speak with them and find out what they want, what they would like to get, what's their problem, what's their concern, what's affecting them, and how can we solve their situation, because it's not just a person coming to work, but it's their life as a whole. Sometimes people might leave because of what they're going through at home. So is there any way I can help you with that? How can I solve your situation or send you somewhere to get some help?
Thank you,
Thank
Finola.
you.
Britt?
As the chair of the HR committee of the hospital, I'm pleased to report that while there is some turnover, every organization has it, our healthcare system actually received the 2018 Gallup Workplace Award. For those of you who aren't familiar with the Gallup organization, they do best-in-class polling to understand what are the dynamics at play in your organization. And they found that Sarasota Memorial blew it out of the water on every metric related to, I feel like my supervisor cares about me, I have the tools I need to be successful at my job, blew it out of the water compared to the national average healthcare system. That survey was not run again this spring due to COVID, but will be run in the next few months. So we just want to start and say that our HR team is working very hard to remind employees of how much they are cared for. The board recently approved a bonus to all full-time and part-time workers in the month of August, thanking them for what they have done to show up to work every day with a smile. And I also want to acknowledge that we have provided meals for them, as well as t-shirts that say, I'm a hero. So that does a lot for them during the day and when they come home at night to show their children.
Thank you, Brett. Vicki? Vicki, I think
Yes.
you muted.
I got you unmuted now. I'm unfamiliar whether you are doing exit interviews at the hospital, but that might be a welcome addition to what your surveys are and getting at whatever the issues are when people leave. And I'm pleased to hear that things are a lot better than the question sounded at first. And so providing incentives to employees is always a good thing. Thank you.
Thank you, Vicki. Sarah? Sarah, you are muted.
Twice I've done that. Sorry about that. I would mimic Tram and Britt. We are lucky that we actually don't have the high turnover rate that a lot of organizations have, especially during COVID. So like Tram said, the people that we have lost have been less than a year employed with us. And I think, COVID also makes people nervous to go to work. So that was understood. And the positive things they did, not only were we giving the bonuses, providing meals, but I think just having a grateful heart through the whole thing and a passion to understand that they are, nervous and the employees are going through just like all of us, that unsurety and just making sure that they're comfortable in their work environment and so they're able to do the best job they can. We definitely want this to be the best place to work as well as best place to be a patient.
Thank you, Sarah. Sharon?
Yes, I would echo what my colleagues have said as well. I have been, as I mentioned, a professor of nursing. And while I was a professor of nursing, when those students graduated, the first place they wanted to work at was Sarasota Memorial. And I will tell you, I get goosebumps when I walk through the halls of the hospital and I see these nursing students that are now nurse practitioners, RNs. They have been there for years. They love Sarasota Memorial. They not only have knowledge here, but they work with their heart. And I get, like I said, goosebumps talking to them. We have recognition, employee recognition, and I'm bowled over by the thought and to see 35-year, 25-year employees there. I could just cry when I see them. And they're so sorry that they're leaving and retiring. They still want to work for another 10 years. We meet our benchmark all the time. And I'm so happy for that. Thank you.
Thank you, Sharon. Bud?
Absolutely wonderful. To hear what you guys are saying is terrific. And that's the way it should be. Every employee wants to feel fulfilled. They want to feel pride. They want to feel respect in what they're doing. And the hospital participates by giving them education in all their systems and the new technology. Being part of the best health system is probably one of the best retainers of employees anywhere. Thank you.
Thank you, Bud. The next question. Do you believe the community would be better served by maintaining Sarasota Memorial as a not-for-profit institution versus selling to a for-profit institution? The first question is to Tram Hudson, followed by Lori, Britt, Finolia, Sarah, Bud, and Sharon. Tram?
Kitty, thank you for that question. That is a question that the board dealt with in 2013 in a special meeting of the board. There was an effort to look at selling the assets of Sarasota Memorial, and the board unanimously came on the side that it's our intent to remain a public, not-for-profit hospital. Just as a little background, the hospital was founded in 1924. We have a long history in Sarasota County. And in 1948, the citizens of Sarasota voted to have an elected board govern and to maintain it in the future. And I am fully committed to maintaining the public nature of our hospital, and I would oppose any effort to privatize it. Thank you.
Thank you, Tram. Lori?
Tram, I agree with you again. I absolutely believe in the hospital being a not-for-profit hospital. The hospital is really a safety net for so many people in our community that absolutely rely on the services. It's crucial that, especially now with COVID, everyone knows that they have a place to go and that they'll be receiving excellent care at SMH, regardless of their means. I think also the fact that the board has committed to this incredible growth, the incredible new cancer facility, the new behavioral health facility is possible because of the community nature of the hospital. I think a lot of the decisions we make are because we're committed to the community and not committed to making a profit.
Thank you, Lori. Britt?
I believe Sarasota Memorial is at its best when it's in the hands of its own people. So I would support it remaining as a not-for-profit organization. I was raised with the understanding, if it ain't broke, don't fix it. SMH is not broken, just the opposite. It's working well. It excels in patient quality, care, and outcomes. We are actually ranked the number 37 hospital in the country by US News and World Report. We have received 5 stars from the Center for Medicare and Medicaid Services 5 years in a row, and it's only been offered for 5 years as they've analyzed patient quality and satisfaction and outcomes. I absolutely will work to protect SMH as a community-owned hospital and healthcare system. I think it's important to note that if a hospital is privatized, they don't have to offer the services they don't want to offer. I'm thankful that Sarasota Memorial offers and is the only hospital to offer labor and delivery services, to offer behavioral health care, to offer internal medicine practice in Newtown, which didn't have any doctor's offices previously.
Thank you, Britt. Thank you.
Thank you.
Vinolia?
I was laughing because I wrote down, if it's not broken, why fix it? And she said it, and it's so true. I'm a volunteer at the Venice Regional Hospital, and I also have a nonprofit organization. I understand the importance of having a nonprofit and having the ability to get funding from people who actually care for the vision and the mission. And I think the vision and the statement of the hospital is clear, and the people who have been supporting it and those who will be supporting it want to continue have it that way. And if we were to change it, then that would change a lot. So again, if it's not broken, why fix it?
Thank you, Finolia. Sarah?
Great words. I agree completely. One of the things which Britt just briefly touched on is some of the great things that we can do in the community because we are a community hospital and we listen to what the public wants and needs. So not only do we have the Cancer Institute, as Britt mentioned, 40% of people are traveling to other areas of our country to get those services. We heard that need and we acted on it. I think, that says a lot about the hospital and the board, and they're listening to what the community wants and needs. Last week, I toured the community's, their services, the specialty services, and the forward thinking for people that couldn't get maybe a colonoscopy or dental work. They have over 20 different treatments that they're giving based off volunteers from our hospital going into this clinic to give to our community. So all of these things wouldn't be happening if we weren't a community hospital. So I 100% support it staying as a community hospital.
Thank you, Sarah. Vicki?
I'm definitely in favor of keeping it as a community hospital. Without it, where would we be? What would we do? People would be up in arms and healthcare would suffer. So definitely, I ditto all that has been said and keep it as a community hospital. And frankly, my background is in community needs assessment, so I feel I can contribute to getting further into the depths of what the healthcare needs are in this community.
Thank you, Vicki. Bud?
I think that I'm certainly in favor of keeping Sarasota Memorial Hospital System as a community hospital. I've gone through this process many times before, and one of the things people seem to forget is that if you sell to a for-profit, the organizational goals of that for-profit take over local goals and objectives. Also, the profits, if there are any at the end of the year, may leave the community and go to Texas or Alabama or somewhere else. The processes of recruitment, incentive, they're all hinged on how the community and the organization perceives the people in the community. So that's my answer.
Thank you, Bud. Sharon?
Yes, first of all, I want to thank everybody for their commitment to keeping our community hospital. And I do want to say that back in 2016, all the candidates that were running for the hospital board voted to keep the hospital as our community hospital. And I'm so grateful for that. And when you really think about it and you see all the services that we provide, we have improved access to care for all who need it. We are a safety net for the community. We deliver the lion's share of the county's inpatient, Medicaid, and charity work. We don't turn anyone away. This is our hospital. This is where we get treated. This is where we work. It's a pillar for us in this community to have Sarasota. So I concur with everyone. Let's not fix it if it's not broken.
Thank you, Sharon. Thank you. The next question. If elected, would you advocate for Florida Medicaid expansion to help offset fees that are currently uncollected? The first question is directed to Finolia, followed by Britt, then Vicki, Sarah, Sharon, Bud, Lori, and Tram.
Yes, I would advocate for that because, as you know, because of COVID, a lot of people have lost some of their jobs. There's a lot of issues where people cannot afford certain program or certain treatments. So Medicaid would be of great help to those people. And Sarasota is growing as well. And people from all over are coming down here, like me. So some people, when they come, sometimes they may not have everything they need. So having a program like that while they're settling in might be very helpful for them. As a home health care agency owner, I've seen firsthand what it's like when people need help and they cannot get it. And if and every little bit help, and that's better for the people's mindset, for their physical well-being. The more help and prevention people get, the less sick they will get, and the healthier they will be. And it's going to be overall better for the society and our county as well.
Thank you, Finolia. Britt?
Before I would advocate for the expansion of Medicaid, I would want to do further analysis as to why those debts were uncollected. And if there were other ways, other levers that we could pull first before we put that on the line item of the state budget. Specifically, our CFO, Bill Wolgen, he and his team have done an amazing job doing collection of payments, and that has improved year over year over year. Yes, we do sign bad debts in charity care every month to the tune of millions of dollars. However, we are a community hospital, and when taxpayers do pay a bit of their property bill, they do go to fund things such as charity care, the internal medicine practice, the community specialty care clinic. Stewarding those taxpayer dollars is one of my most important jobs. SMH received $60 million in taxpayer revenue in 2019, but it provided $150 million in community-directed care in the same year. Tax revenue as a percentage of total revenue has declined in 3% over the last few years, and I believe the closer we can keep things to Sarasota, the better.
Thank you. Vicki?
Oh, I'm on. Okay. I believe in preventive health care, and I think people do much better if they don't have to go to the hospital when they are very, very sick, and do the preventive part early on so they don't get that sick. And so I would be in favor of exploring the Medicaid expansion, along with what Britt is indicating as doing a further study of why people are not able to pay, and getting that information collected. My dog's jumping on me right now. Thank you.
Thank you, Vicki. Sarah?
I agree that I would like to sit down with our leaders to understand more in regards to that. Bill does do, and his team does an amazing job. It is discussed in the financials at every board meeting, so it's not something that's taken lightly. I also think because we are a community hospital, and as we all just indicated, would like to stay that way, we do have a lot of services that will help patients from not going strictly or directly to the emergency room, which I think in a lot of towns, they don't have those opportunities to go to specialty clinics, to go to community clinics. And so they immediately go to the emergency room, which the cost is significantly higher and then harder to pay. So I think certainly I would need to do some more research, but I don't think I would approve, adding onto our tax bill before we have the knowledge.
Thank you, Sarah. Sharon?
Yes, I concur with everyone, being one of the last people to talk about it. I think our administrators continue to press the Florida legislature to expand Medicaid benefits for all who qualify for it. I think that's been ongoing for quite a few years now. I remember the discussion back in 2016 for all candidates, and I remember what Tram had mentioned when he spoke of it. But please keep in mind, we don't turn anyone away. We do have inpatient Medicaid and charity care. We have a long history of developing and maintaining programs that ensure that low-income community members have access to the full complement of inpatient and outpatient care. We are doing it right, and I think everybody gets served. Look at what we did over in Newtown. We have our residency program over there, and they are doing remarkable work.
Thank you, Sharon. Bud?
I think that we need to explore every funding source that we can, especially as we continue to add services to SMH. and try to fulfill really all the healthcare requirements in the county. Funding is very important. I think we ought to continue exploring it. Thank you.
Thank you, Bud. Lori?
So absolutely, I think it's in order to maintain the excellent quality of care that SMH is providing, we do need to look at every option. I will say, when we consider revenue, one other area of revenue to consider, of course, we have the wonderful foundation, and philanthropy is so, so important, and our community is so generous. I think we can also look at grant writing. They're incredible foundations, private foundations, state foundations, federal foundations. Fundraising and grant writing was a big part of what we did in our corporation, and I would love to contribute those skills to the board. But we need to keep and maintain and build on our excellent quality of care, and let's look at every option.
Thank you, Lori. Tram?
I may be an outlier on this. Number one, Medicaid expansion is a state issue. The state legislature, the governor, the cabinet, those are the ones that really decide whether or not we expand or agree to Medicaid expansion. And thus far, the state of Florida has chosen not to participate in that. The impact on Sarasota Memorial, as we are seeing right now unfold, is the state budget cannot afford to continue to fund the amount of Medicaid assistance that they have been given to all the hospitals and to the individuals. The second point I'd make is the hospital board has not set a policy or a firm recommendation of Medicaid expansion. I don't believe that it's ever been brought before the board, and I doubt if it will be brought before the board in the near term.
Thank you, Tram. Lori?
She's already spoken.
Oh, I'm sorry. Okay. We have one last question. And what lessons might be learned by the board from the challenges of COVID-19 this year? And the first question will go to Britt, followed by Finolia, then Sarah, Vicky, Bud, Sharon, Tram, and Lori. Britt?
What lessons have been learned by the board? Having really tight partnership with the management team. The board's job is to oversee the finances, the strategy, and the management team. We're not the executors, but we are the bosses of those people. And I am really thankful that every time I had a concern, a question, President and CEO David Barrender picked up the phone. Chief Nursing Officer Connie Anderson picked up the phone. Chief Operating Officer Lori Lang picked up the phone. They were very responsive to protocols at the CDC and actually did more than what the CDC was requiring at each moment. They kept the patient first in mind. I really can say that SMH has achieved its success because it thinks about patients and it thinks about its employees. We invested millions of dollars in disinfecting robots, in personal protective equipment, and actually our hospital was the leader at the negotiating table, getting the best prices on PPE on behalf of many other safety net hospitals. So great communication, being very active to pivot to telehealth services in the future. Telehealth is the way that we need to adapt medicine.
Thank you, Britt. Finolia?
Yes, well, I believe the hospital did a good job. They have an extensive emergency preparedness plan in place to respond to threats ranging from hurricanes to disease outbreaks. So they work closely with the local staff and state and federal emergency management and public health officials, and they did an outstanding job. They used PPEs, they had good infectious control protocol planning, and they worked and communicate with the staff and everybody, and it shows, the data shows that they did a wonderful job, and I'm very, very happy with the work that was done.
Thank you, Finolia. Sarah?
I am incredibly proud of our hospital and how we handle this. David Verinder at the top, all the way down to the hospitality staff, and everybody really did extraordinary at keeping our hospital, our community, and our patients safe. You know, it wasn't easy, but we have some astonishing doctors that worked hard at that. Dr. Fiorica has done so much research into different methods and implementing them very quickly to change and make sure that our staff and patients are safe. So I am very proud, and I hope that we just continue to do that. Who knows what's ahead in the flu season with this, but we need to focus and stay positive that we can fight this as a community, and that we will. We really, when we worked well together, we can do a lot more than just single-handedly.
Thank you, Sarah. Vicki?
Yes, Sarasota Memorial Hospital has done a marvelous job during this COVID pandemic. They're well versed, they're well up to date. I'm very impressed with the research end of things that's presently being done. They're keeping finances in order. So many hospitals are struggling financially due to COVID, and it's really amazing how well intact Sarasota Memorial Hospital has remained through this compared to many other hospitals in this nation. And so we're very lucky for that. The thing that I still want, if I make it, I would like to do more networking with people who are sitting at home with COVID and their needs that frankly have not been met. They're working on it. We can always improve. So thank you.
Bud?
I think that the board probably learned that their management team is outstanding, and they did a great job financially planning for this event. I think they did a great job with the employees, not only preparing them with education and obviously safety measures, as well as cementing the supply lines to the organization so that they can keep things as they needed to be. Thank you.
Thank you, Bud. Sharon?
Yes, I will talk about COVID as being so unique. We never experienced anything like that before. It hit us hard in mid-March, and our board, our medical staff, our nurses, our organization types, everybody was on board to work with it, to make things happen in a positive way. Communication was relevant for every service. We were all transparent. We had cases that were being studied. We have studies that are being studied. We now have post-COVID studies. We are working with several pharmaceutical companies studying post syndromes, and Sarasota Memorial can't do any better than what they've done as far as working with it, trying to get some policy and some plans for the future when we have our twin pandemic coming, which is the flu and the COVID together, which could be our second wave. Thank you.
Thank you, Sharon. Tram?
I would echo what Bud said, is that we did learn that our management team, the medical staff, the nursing staff, everyone at Sarasota Memorial pulled in together. Communication and leadership was absolutely critical, as Sharon outlined. I would say the second thing is how quickly we responded when we suspended elective surgeries, excuse me, and other procedures. Our revenue fell like a rock coming off of a cliff, and management took steps to reduce expenses. I think you probably are aware that we furloughed over 1,000 some odd employees, used flex time to address some of that. You know, thankfully we've been able to bring those people back on. but management also took a cut in pay during that period. And the third thing is that just as so many industries are going through disruption, like the Amazon, the Uber, COVID is healthcare's disruptor. And I think we are going to learn a lot from this experience.
Thank you, Tram. Lori?
So I agree that SMH and the incredible people within SMH have done a magnificent job responding to COVID. I think that one of the lessons from COVID is that we need to expect the unexpected. What we know, what many people have said is COVID can be a dress rehearsal for what's to come, from hurricane, from rising sea levels. The more that we could do to anticipate what could happen, the better we'll be able to prepare, making sure that we have the inventories that we need, making sure our teams are really ready with all of the protocols. I know that we have our disaster readiness plan. The better we could coordinate with the Department of Health, with environmental agencies to make sure we have the information we need to be really ready, the better off we'll be. And so that we could support our great doctors and nurses.
Thank you, Lori. Thank you all. I'd like you now to please summarize why voters should elect you to the hospital board. And we'll start with Vicki, then Sarah, Sharon, Bud, Lori, Tram, Finolia, and Britt. Vicki, please start.
Thank you so much for having me tonight and letting me introduce myself to all of you and my background, particularly in public health. And at this present time, there isn't anyone on the board with this type of experience that looks at the community the way a public health person does. And I think that would be a great benefit to the hospital, the community, and the board for all of us. I believe in very effective, efficient planning, programming, and analysis. I hope to have your vote. Thank you so much.
Thank you, Vicki. Sarah?
Yes, thank you so much for the opportunity to serve this community. When I was appointed back in May, it was a great honor, and it would be an honor to continue. I've really enjoyed working with the board, meeting the staff, walking through the hospital. You may not know, but I am a health science major. And then my CFP, I think, is a good tie to understanding the financial background, planning, strategic planning, and really implementing in a hospital setting. So I would be honored to continue, and I appreciate it.
Thank you, Sarah. Sharon?
Yes. What will I do in the next 4 years? As chair of the quality committee, I will continue to bring patient safety to the forefront. I'll oversee the opening of the Sarasota Venice Hospital and the Cancer Institute. I'll manage financial well-being and strive to protect your tax dollar. Our hospital is safe, our performance is morally, ethically, and financially stable, and we strive for constant improvement daily. I'm an advocate for patients and their families. I want nothing more than qualified doctors and nurses who think with their heads and feel with their hearts. I continue to be up to date, educated, and current in the healthcare industry as a nurse practitioner for the past 50 years. I am currently in private practice with a cardiologist, and I have peer-reviewed clinical privileges at Sarasota Memorial since 2015. I'm hoping to be reelected and do another 4 years with my expertise. Thank you for having me.
Thank you, Sharon. Bud?
Thank you. I want your vote, and I hope that over the course of this forum that you've had a chance to get a sense of my education, experience, and desire to help create an even more beneficial healthcare system for all of the SMH service area. The system continues to strive for excellence in everything it does and meets and/or exceeds the needs of the community it serves. I think that I can help to continue these efforts and hope that you allow me to serve as a member and guardian of our healthcare system. So, please vote for Everett Bud Weber for the SMH at-large seat number 1. Thank you.
Thank you, Bud. Lori?
First of all, I just want to say that I've been so impressed with all of you, and it would be an absolute honor to work with all of you on this board. And no matter what happens, I'd love to be involved. I think that the qualities that I could bring to the board would, number one, I'd absolutely focus on behavioral health and make sure it's integrated into every aspect of the hospital. I think my background in STEM and my connections with environmental agencies, a focus on what's happening with our environment, I'd really focus on preparedness to make sure we're ready for what might happen. And lastly, I'd be a team player, supporting the board, supporting all of us, and supporting all the great doctors and nurses within our system.
Thank you, Lori. Tram?
Let me say thank you to the League of Women Voters for putting this on. We appreciate the opportunity to spend time with all of you. You're one of the few organizations that allow the hospital board to have public events like this, so thank you. I have been honored to serve on this board for the past 5 years. And as mentioned earlier, one of my focuses is to continue our strategic plan, the completion of the Venice Hospital, the Cancer Institute, as well as, and I didn't have time to expand on it, but the graduate medical education program in terms of addressing doctor shortages, which are on the horizon. Finally, I would say that as a board member, we're really representatives of the citizens of Sarasota County. We have a responsibility to them to ensure that our hospital is the best that it can be, that it is managed in an ethical and financially sound manner. And as chairman of the audit committee and also the investment committee, having the integrity in our financial statements is very important to me. And I hope to be able to continue this for one more term, 4 more years. Thank you so much.
Thank you, Tram. Finolia?
Thank you for the opportunity to be on this call. I'm very happy to be here, always grateful. I am different. I came from a country of nothing. I did not speak English when I came to America. I learned to speak English. I speak French. I speak Creole. I speak Spanish. I learned Spanish because I studied in Mexico. I've traveled to Africa and I'm learning my husband's language. I'm very diverse, and I believe diversity helps bring change. Add a little color to things, you will see the difference. I think it's time. This is the right time to elect somebody like me. I do look different, but don't take the look. Take my educational background. I have many years of studies. I've worked in hospitals in Brooklyn where I helped the hospital implement program that has to do with Joint Commission in the past. I also am a minister, and I also study psychology, and now I'm studying business. So I have a wide range of background because my passion is anti-aging, helping seniors, and learning about the human psyche. So the more I can help bring my knowledge, talent, and passion, I will do it. That's what I do. I love to volunteer and help. I know I'm busy, but anything I can do to help, even if this don't happen, I will continue to help.
Thank you. Britt?
I am a trusted community leader running for re-election. Delivering compassionate, quality, and innovative care is SMH's mission, and it's also mine. I have the patient first in my mind whenever I ask a question or make a vote. I also have the employee in mind. As it's been said, SMH has almost 7,000 employees. That makes us the largest employer in Sarasota County. And we are an award-winning hospital because of our team. I'm excited to continue overseeing the hospital's finances, management, and 10-year strategic plan, including the opening of the Cancer Center, the Venice Hospital, and reimagining how we serve behavioral health. But I'm not only a board member, I'm also a patient and a loved one of a patient. Because I trust SMH, I gave birth 3 times at SMH. I took my newborn to the ER during the height of COVID. My mother endured major surgery, and I held my grandfather's hand as he passed away at this hospital. You can be sure I lend my hand and my heart to the task of hospital board member. As a 29-year resident, I know this community well. A vote to re-elect Britt Reiner is a vote to advance our community's healthcare.
Thank you, Britt. Thank you, candidates. Thank you for your participation. And thanks to our volunteers, including Carol Hartz, Pat Price, Linda Thompson, Villia Johnson, Nancy Morrison, and Bob Burgess. Viewers, if you're unable to ask your question, please follow up with the campaigns directly using the information provided on our online voter guide at Vote411. And finally, remember that your vote is your voice, and the Sarasota League thanks you for being with us. Thank you all.
Thank you.